Hello everyone, I am Madhvi Singh, Assistant Professor in IIMT College of Pharmacy. Today we are discussed about reproductive toxicology studies. Content we are discussed here is reproductive toxicology, OECD guidelines, selection of animal species, dosage, experimental schedule, pathology and histopathology, data and reporting, then evaluation of result. First is what is reproductive toxicology? Reproductive toxicology is the study of the effects of chemicals on the reproductive system and neuroendocrine systems and also the embryo, fetus, neonate. Reproductive toxicity refers to structural and functional alternation that affect reproductive system in sexually mature males and females. Next is OECD guidelines for testing of chemicals on reproductive toxicology. What is OECD and OECD stands for? OECD stands for Organization for Economic Cooperation and Development. And here is the guidelines. Principle of the test chemical is administered in graduated doses to several groups of males and females. Males should be dosed for a minimum of 4 weeks and up to including the day before scheduled kill. Pre-mating dosing period in males, fertility may not be a particular sensitive indicator of testicular toxicity. Next is therefore, detailed histological examination of the testis is essential. Histopathology of the male's gonad is considered sufficient to enable detection of the majority of effects on male fertility and spermatogenesis. Female should be dosed throughout the study. Duration of study following acclimatization and pre-dosing estrus cycle evaluation is depend on female performance and is approximately 63 days. This include mating, the duration of pregnancy, and including the day before scheduled kill. Next is description of the method. First, selection of animal species. According to guidelines, selection of animal species. Guidelines is designed for use with the rat. The rat was only species used. The test animals should be categorized as to species, strain, sex, weight, and age. Weight variation of animals used should be minimal and not exceed 20% of the mean weight of each sex. Animals from the same strain and source are used in both studies. Next is housing and feeding. Animal housing. The temperature in the experimental animal room should be 22 degrees Celsius plus minus 3. Relative humidity should be at least 30%, not exceed much. Light should be artificial, the photo period being 12 hours light, 12 hours dark. Animal feeding. For feeding, laboratory diet used with an unlimited supply of drinking water. No more than 5 animals should be housed per cage. Pregnant females should be caged individually and provided with nesty materials. Lactating females will be housed individually with their offsprings. Next is preparation of the animals. Healthy young adult animals are randomly assigned to the controlled and treatment groups. Cages should be arranged in such a way that possible effect due to cage placements are minimized. The animals are uniquely identified and kept in their cages for at least 5 days prior to start of the study. Dosage. First preparation of doses. The test chemical is dissolved or suspended in a suitable vehicle. Procedure. First is number and sex of animals. It is recommended that each group be started with at least 10 males and 12 to 13 females. Generally, at least 3 test groups and a control should be used. Dose labels may be based on information from acute toxicity test or on result from repeated dose studies. Next is administration of doses. The animals are dosed with the test chemicals daily for 7 days a week. The volume should not exceed 1 ml per 100 gram body weight, except in the case of aqueous solution, where 2 ml per 100 gram body weight may be used. Experimental schedule, which is designed for the reproductive toxicology, is dosing of both sexes should begin at least 2 weeks prior to the mating. Females have been screened for normal estrus cycles. Dosing is continued in both sexes during the mating period. Males should further be dosed after the mating period, at least until the minimum total dosing period of 28 days has been completed. Mating procedure. Normally, 1:1 mating should be used in this study. Each morning, the female should be examined for the presence of sperm or a vaginal plug. Clinical observation of this study. Throughout the test period, general clinical observation should be made at least once a day, and more frequently when signs of toxicity are observed. They should be made preferably at the same time each day. All signs of toxicity, including mortality, should be recorded. These records should include time of onset, degree of toxicity, and duration of toxicity signs. Body weight of the animals. Males and females should be weighed on the day of dosing, at least weekly thereafter, and at termination. During pregnancy, females should be weighed on days 0, 7, 14, and 20. Estrus cycles. What is estrus cycle? It is similar uh, to the menstrual cycle in humans. Estrus cycle starts at the onset of sexual maturity and stops during pregnancies. It is the simply we are say that it is the menstrual cycle in animals. So here is estrus cycle should be monitored before the treatment starts to select for the study females with regular cycle. Vaginal smear should also be monitored daily from the beginning of the treatment period until evidence of mating. Offspring parameters. The duration of gestation should be recorded and is calculated from day of pregnancy. Any abnormal behavior of the offspring should be recorded. Pathology. Gross necropsy. At the time of sacrifice or that during the study, the animal should be examined macroscopically for any abnormality or pathological changes. Vaginal spear should be examined in the morning on the day of necropsy to determine the stage of estrus cycle and histopathology of ovaries. The testes and epididymides of all male adult animals should be weighed. Next is histopathology should be performed on the ovaries, testes, epididymides of the animals of the highest dose group and the control group. Okay, then is data and reporting of the experimental work. Individual animal data should be provided. Additionally, all data should be summarized in tabular form, showing for each test group the number of animals at the start of the test, the number of animals found dead during the test or killed, the time of any death or humanic kill, the number of fertile animals, the number of pregnant females, the number of animals showing sign of toxicity, a description of the sign of toxicity observed. All the data should be provided. Next is evaluation of result. It is the last point of reproductive toxicology. The findings of the toxicity study should be evaluated in terms of the observed effect, necroscopy and microscopic findings and macroscopic findings. Male and female reproductive toxicology. Male fertility method. One rodent species, yani ki rat, we are taken 3 dose group taken, each 6 adult males. Drug treatment by clinical route for 28 to 72 days. Mixed with female in 1:2 ratio. Female getting pregnant should be examined after 13 days of gestation. All male animals sacrificed, weight of testes, epididymis recorded and examined for their histology, sperms examined for motility and morphology. Female fertility. What is the method is drug administered to both males 28 days and females 14 days before mating. Segment 1, fertility and general reproductive performance history. Segment 2, teratogenicity. And in segment 3, we studied perinatal and postnatal study. Okay, this is all about reproductive toxicology, which we are discussed here. Thank you, everyone.